Okay, welcome everybody. Back, like I said, Friday, 2 o'clock, our usual time slot. Um, Today we're going to talk about a subject that is very, very important to me, and I speak very passionately about it. I love discussing it, and what we're going to talk about today is how acupuncture works. Because we were talking about stress and we're talking about the release of endorphins. But today we're going to create the framework for discussions going on into the future. So when we talk about certain effects, we can see how they apply. I tell everybody, number one, we don't ask if acupuncture works. We know it works. One way we know it works is through animals, because animals respond really well to acupuncture, and you can't fool them. So the placebo mechanism is out of the window because you can't trick animals into feeling better or getting better. They just get better. A lot of research studies, randomly controlled trials work off of placebo. We want to. The goal is to trick people into getting better, or tricking them into thinking that they're getting better, and then comparing it to the procedure. Now, originally we tested on animals before they go on randomly controlled trials, but generally acupuncture is so safe. It hasn't, if you're trained, you're not going to hurt anybody, which is important. And we'll talk about that down the road as far as safety. So there's really no harm. It bypassed a lot of like basic scientific study and studies on animals because it didn't really harm anybody, and it went into randomly controlled trials. Unfortunately, randomly controlled trials are structured to test pharmaceuticals, and it doesn't necessarily translate really well to a procedure. And we also see this even in comparison to a lot of surgeries. Well, they'll say that surgeries are just placebo, and it's basically nonsense. It's just the way it's set up. It's set up to test for pharmaceuticals and chemicals and substances, and that's just not how we operate. So getting that out of the way, that's important. We know it works. It works on animals. Animals don't believe in placebo. You can't trick them into getting better. They just get better. So then we're breaking down the effects of acupuncture to three basic effects and a fourth one, which we'll touch upon later, which is fairly new. It's local, a regional, and then central effects. So starting with the local effect in general terms, the best example is to use a cut, right? What happens when you cut yourself? You don't bleed out and die. The body basically takes care of it. And how does it do that? It does it by bringing circulation. So the number one simple effect of acupuncture is increasing circulation to an affected area. So why do we want to increase circulation? Why? Because the blood basically has everything that we need: nutrients, oxygen, healing mechanisms, and platelets, and clotting, and all sorts of chemicals to help build up the tissue. So using the example of a cut, we cut ourselves, we heal, we stop bleeding, and we repair. So in one way, we're hijacking that mechanism to treat specific areas. So one most obvious uh, treatment strategy is um, trigger points, knots, muscles that aren't getting the right blood flow because we sit or we stand too long, or overuse. We want to bring circulation there. So the perfect example is recurring chronic pain. I say that pain that is 3 to 8 responds well to heat and stretching is a muscular type pain, which could be a trigger point, could be a spasm, could be just a shortened muscle because we've been sitting on it all day long. It doesn't get the attention it needs. We immediately increase circulation through, the terminology is called micro injury. So going back to that cut, which is painful and harmful, right? We're kind of shrinking it down to the microscopic level and targeting exactly the area that we want to get. Okay, so when we use the terminology micro injury, we're using the head of a filament, not a needle. We'll get to that later. We'll call it a filament for now, not a needle. We're targeting the area that we want to repair, namely a trigger point or a spasm, and we're getting the circulation there to patch up and fix things. Okay? Now, that has an impact. when we do that, we release a whole bunch of neurochemicals, right? Hormones and neurotransmitters and all of these things. And that's complicated. We'll get into that when we go deeper into the local effect. We'll talk about everything there. But that has a resounding effect on the nervous pathway of the area that you're treating. So if we treat the hand, it goes to the brain. If we treat the toes, it goes to the brain. If we treat the back, it goes to the brain. And it's going to travel up a nerve pathway. And that nerve pathway is the same pathway that perceives chronic pain. So what is chronic pain? It's a dedicated fiber that perceives that 3 to 8 pain all the time. That doesn't get any better. The body doesn't know what to do with it, so it kind of disregards it, and you go on living in pain. But at the same time, we have acute pain receptors, the ones that feel getting hit by a bus, stabbed, or shot by a gunner, like really, really 9/10 emergency room ambulance ride type pain. Now, with the micro injury, what we're doing is we're accessing that mechanism, right? We're actually harnessing it, but we're not causing the damage and the pain and the discomfort that the 9/10 pain feels. So what we're doing is we're basically using acute pain fibers that sense acute pain to override chronic pain signals. Okay, so think about when you're stuck in shore traffic the next time, maybe higher up or lower down on the parkway, depending on, or let's just say the turnpike for that matter, right, where you have a semi truck. The pain signal is like a semi truck, whereas the acute pain signal is a little more maneuverable, like a sports car or a motor. Look at the motorcycles next time you're on there; they're dodging and weaving out of traffic. They can get to the brain and override or stop the truck. So when the truck stops, it's got to get into gear again to pick up speed. So we can get to the brain a lot faster to cut off or block the pain signal. Okay. Also, the example of that is what we call the hot tub phenomenon, right? Have you ever been in a hot tub that's so hot it doesn't stay hot, right? The body actually modulates that signal so it's less annoying or less insulting. This is what we call the diffuse noxious inhibitory controls. Okay, it's a mouthful, but it's important because we can actually, with acupuncture, use that over the regional effect, over the course of a nerve pathway to keep your pain from getting to your brain and being perceived, the chronic pain signal. Okay, so we have the local effect, which then leads to the regional effect. Another example of local treatment is in the case of women's health. If we have a woman whose lining is not up to par, we actually can, divert the blood flow to the lower abdomen to increase the circulation, thus increase uterine lining. So that's one other effect of the local. Now, when we're treating and we're needling or using the filament to activate the local neurology, we have what's called the twitch response or the local twitch response. There's an aspect to the nerve pathway. Not only does it bring sensation like pain or lack of sensation, numbness if it's in an aberrant state, we also have what's called motor sensation, and that's like how we move our hands or where our hands are at any given time, along with temperature and pressure. We can access these receptors to block the pain signal, and one of them is a motor receptor. And one way we do to unlock that tight spastic muscle that's stuck on, we actually kind of get it to twitch to actually shut that pain, shut the motor signal off to get it to relax. And that's part of the regional signal. So the regional effect. So locally, we're increasing circulation. We're modulating how the nerve pathway perceives the signal. And then the final one is the central effect, which once these signals get to the brain, they actually alter the perception of pain. So the examples, like notice if I mentioned the term filament. If I were to say needle, people tell me, oh, I don't like acupuncture, I don't like needles. I say, that's great. We don't use needles, we use filaments. Why do I say that? Because when we were younger, we were poked and prodded by our pediatrician, and we remember what a needle feels like, and that is kind of invoked. That's the same memory that you have of your chronic pain from sitting at a desk. So once people get out of pain, it's not like a clean bill of health. People still have like this apprehension. It's called this dyskinesia, right? So we're kinesiophobia. I'm sorry. We're afraid to move a certain way because we don't want to bring on the pain that we had for so long because it's stuck and stored in our brain. So when this nerve signal actually gets to the brain, we're actually altering how we perceive it. We can stop it, we can block it, we can alter it. right? But at the end game is that we're also releasing endorphins. Endorphins further treat the pain locally, but then, like we went, if we kind of backtrack to our stress lecture, we know releases endorphins, which gets us to relax, right? Because the pain is uncomfortable. We're very tense. Some people store their pain. I know here a lot of people store their pain in their upper back and neck muscles on top of typing. It's the perfect storm. If we can get people to relax and get these muscle fibers to let go, it's also contributing to the overall therapy. Okay, so to recap, local, right? Remember how we cut ourselves, our body repairs it. Regional, it's the hot tub effect, right? When we have this acute sensation that's annoying, our body's gonna override it and regulate it. And then the central effect is when the signal gets into the brain, we alter how it feels the pain, we alter how we perceive the pain, but we also relieve endorphins, which further cuts down on our autonomic dysfunction, right? We have fight or flight stress response, and we have rest and digest where we recuperate and recover. If we're constantly stuck in sympathetic or hypersympathetic, right, because we're always stressed out, right, then our body doesn't get a chance to rest. Like I said, we sleep, maybe we don't get rest. When we allow the endorphins to put us into parasympathetic, the third effect of acupuncture, then we can regulate a lot of the stuff, especially hormone releases. You'll hear the terminology of the hypothalamic pituitary ovarian axis. We'll talk about that later when we get into women's health. That's how hormones regulate cycles and periods, and it affects, regular periods, fertility, and menopause. We'll talk about that down the road. And then the hypothalamic adrenaline axis, that's just how we stress out and freak out. You hear the term adrenaline junkie. People get addicted to the feeling because, noradrenaline and epinephrine are similar to like cocaine and amphetamines, and then the endorphins mimic the effect of opiates, right? Because they're called endogenous opioids. They're not the same thing. They belong there, not like a pill which throws things off. They belong there, and we can harness that mechanism and help people. And one final point I want to bring up, which we'll talk about way down the road, is the epigenomic effect of acupuncture. In the sense that everything that we're doing here, we're releasing certain types of chemicals, and these chemicals have cascades. And the end game is through these chemicals, we can affect how certain genes express themselves, right? And it's a mouthful and it's complicated. But we know through the study of epigenomics that environment, right, turns certain genes on and off. Like bad diet, bad lifestyle, living next to a nuclear power plant can turn certain gene for cancer on and off. So with that being said, acupuncture has an epigenomic or environmental effect that can, yes, turn certain genes on and off. And we'll get into that a lot more down the road because it's a topic I really enjoy talking about. And I had studied extensively during my doctoral studies, and I want to share that with you. So with that being said, thank you for tuning in. We'll be back Monday where we're going to deep dive into the local effects of acupuncture. And that's about it. So thanks for tuning in.